Dr. Doler, thank you very much for being with us first. And let's start with a really most basic question people may have asking themselves. Should I cancel my travel?
No, no. So during this coronavirus outbreak, WHO has specifically said that there shouldn't be any travel or trade restrictions. This includes most places in China. The risk of being infected is low in many countries. The epicenter is still, as we know, in the Hubei province in China. Some countries we know that they have issued quarantining of people coming home. This is usually based on a risk assessment identified by individual countries. And travelers should not really cancel their plans, but they should take into account the various restrictions that airlines have put in place when planning for their next trips. Thank you.
Is cabin environment, plane cabin, dangerous in any way?
No, absolutely not. We know that the virus so far is transmitted via droplets or fomites, which means a close contact with people that are infected and that are shedding viruses. It is possible that the virus can live on surfaces as well, but for a short amount of time. The best thing to do in a cabin is to practice proper hand hygiene, to wash hands properly with soap and water, or to use alcohol-based rub, and to use coughing etiquette, and to really keep the distance from people that are coughing or having symptoms.
Well, you already answered my next question about measures people can take, but how different it is from what we recommend, let's say, for seasonal influenza?
Is not different at all. Similar to the seasonal influenza, people should be practicing the regular protection measures for respiratory infections, which means, as I said, coughing etiquette. Make sure you sneeze and you cough into your elbow. Make sure you use a tissue when you sneeze or cough, and you throw away this tissue in a bin. Make sure you keep your hands clean, and make sure that you also have prepare your food using the regular food hygiene practices.
Now let's talk about a very important group of people. That's people working in airplanes, cabin crews. What they should do, what precautions they should take.
They should take similar precautions as the passengers. In addition, they should also be aware of the guidance that airline cruises and crews of airlines have put in place through the IATA, the International Association of Airline Transportation. They also have the need and the requirement to care for suspect cases in the plane, and they have specific guidelines on how to do that, meaning isolation of suspect patients, meaning keeping distance from passengers that may be in contact with them, providing the passengers that are suspected cases with regular materials for proper respiratory hygiene, meaning providing them tissues, allowing specific places for the passenger that may be sick in the plane.
Now, we see lots of people using masks. How effective those masks are?
The masks are very effective for protecting people that are sick from preventing them to shed the virus or to transmit the virus onward. For people that are not sick, masks are not very effective. It's also important to make sure you use the mask properly, and to not touch the exterior of the mask, even if you are not sick. The masks are also important for people that are caring for sick passengers, which is sick travelers or sick people, which is the healthcare workers. So it will be important that people that most need these masks have the access to the masks.
Thank you very much. Now, we see lots of stigmatization of people of Asian origin during this novel coronavirus outbreak. So, question we get, for example, I see lots of tour groups from China. Should I be worried?
No, not at all. The virus originated in China, in specific provinces in China, and the Chinese authorities have taken extraordinary measures to protect the world for spreading externally the virus. That means that people from other provinces are not at high risk, and they shouldn't be discriminated or stigmatized for just being coming from a country that has one province with large numbers of outbreaks.
What precautions should be taken by airport workers?
Airport workers should practice the same hygiene protection measures as for any other workers. For the moment, we know that the virus can subsist for maybe half an hour on external surfaces, but this shouldn't. There's no evidence that the virus can be transmitted by just touching the luggage of other people. So airport workers should also be aware of where they can have the protection equipment. They should be aware of the rules and the procedures that are in place in the airports in line with the regulations of international health regulations, and should themselves protect themselves from getting the virus through the regular measures that we have mentioned before.